Hello, and welcome to the Warren County Public Health How to Prevent Lead Poisoning in Children program. This program today is designed to help parents and daycare providers learn about lead within their homes and how to keep children safe. The program will cover a number of different things, including past and present day lead usage, dangers and health effects of lead for children, testing in children for lead, potentials for lead to be in your home, steps for preventing lead poisoning, and where to find more resources about lead poisoning prevention. So let's do a brief history of why lead was used. It was used in a lot of products because it is very stable, it's easy to work with, and it doesn't really break down or corrode. It was used in things like paint, gasoline, plumbing and solder, batteries, ceramics and pottery, automobile parts, and even some hobbies. It can still be found in our environment today, and it's actually still found in some of the things we may wear or see or use, even in today's world. Old paint and paint chips are a big source of lead in our homes. We know dust mainly from old paint, as the paint breaks down and begins to chip into finer particles, also contain lead. We know there can be lead in soil, left from things like old gasoline if you were near a main road before lead was removed from our gasoline supplies. Water, again, from old plumbing, generally speaking, our water is fairly safe, but it can have lead leach into it occasionally through our old pipes. And then imported foods and herbal remedies that come from outside the United States can carry lead often because they aren't regulated as well and nobody really knows exactly what's in those. And then we still see them in other hobbies and in workplaces. Again, somebody who works as an auto mechanic, certain waste centers. Obviously, if you are involved in any hobbies with pottery or fishing, you may come into contact with lead as well. And finally, we see them in some of our costume jewelries and cheaper jewelries that come from overseas and are often sold as toys for kids or costume jewelry. So why do we make such a big deal about lead? Well, first, lead harms those who are youngest. So children under 6 years of age are often the ones most likely to be harmed by lead. It has a greater effect on a child's body because of its developing body systems, and lead is easily absorbed by children. Children also absorb and retain more lead than adults too because of their body's growth. And this becomes a problem because as that lead is absorbed, it can cause a number of problems, including delays in nervous system and brain development, delays in physical development, cognitive and behavioral issues, hypertension, which is high blood pressure, headaches, and hearing problems. And here's just a little chart showing some of those things as well. And again, lead can build over time. It can also be removed from the body by getting away from the source of lead. But if you don't know that lead's in a location, you're not going to know that you're absorbing it. And we'll talk a little bit more about how we can check our children to make sure they are safe. So how are most children exposed to lead? Often it's through eating paint chips or breathing in the dust and soil that contains lead. Again, paint is bright, it's colorful, lead doesn't have a bad taste, and kids are known to put things in their mouths. Also through their hand contact, which is what kids often use to navigate their new world. So as they're growing and exploring, they're going to use their hands and their mouth to kind of figure out what things are. So we may see them eating or chewing on lead-painted surfaces like windowsills or toys and furniture, especially if they're older toys and furniture that have been handed down through generations. So is there any safe level of lead? Any exposure that is okay? No. Even low levels of lead in the blood can have effects on the development of a child, including slowing their growth and development, and obviously their neurological development as well. So Warren County works with parents to supply education when we get a lead level in a child that is low, under 5 micrograms per deciliter, but still present, just so they're aware of how they can even reduce the exposure to lead further. If we get a result from a lead test with a child that is above the 5 micrograms per deciliter, environmental interventions may be used to help reduce those lead levels as well. That would be a plan that's put in place either by the New York State District Office or somebody contacting our office and working through how they can reduce lead exposure in their home. So who needs to get tested, and are there symptoms of lead poisoning? So when we talk about testing, in New York, the standard is every child needs to be tested at age 1 and 2. And these ages weren't chosen at random. They're chosen because children at these ages often are using their hands, they're crawling, they're moving on the ground, where their exposure is more likely to happen. And also children at ages 1 and 2, again, when exploring, often use their mouth to taste things and find out about the world around them. So we know that that's a great time to test, but we can also look at children who are a little bit older that may need to have a lead test as well. And that could be because they have a high risk of lead exposure, either because lead has been found in the home or because a sibling has tested positive, tested with a high level of lead, and that just raises a concern that it's happening in the same location with other children. So parents, it's really important that you do talk with your child's doctor about getting tested for lead at ages 1 and 2 to make sure that your child has the best chance for developing normally and without any problems from lead. Symptoms of lead poisoning, though, are very mild if non-existent. All right, lead does quickly enter the blood and it can harm the child's health. But we also know that most of the time there are no symptoms, so you don't know it, and some of the effects of lead can be mistaken for delays that are linked to other things like potentially autism or hyperactivity disorders. And so it's really important to see if you can identify another reason for your child's developmental issues, because again, if it is lead, we can help to pull the lead from them and keep them safe. This chart here is all about the lead test itself. I'm not going to read through it all, but as the numbers go up and the amount of lead that's found in a child goes up, so do the number of interventions to keep that child safe and to return their lead levels back to normal. And it's really important that we do this so that they can develop at a normal rate and that they don't have any impediments as they grow. But what if you're a family who can't afford to have a test, right? That sometimes the cost can be a problem. The first thing is we ask doctors to refer the family to public health, or they can self-refer to us as well. Warren County is provided grant funds through New York State Department of Health to help parents be able to pay for the testing for their child to make sure that lead isn't impacting their growth. And it's done through the Glens Falls Hospital. So this here is just a visual representation of what happens if a child needs a lead test and a family has no insurance. They get a script from the doctor, who then the family can call Warren County Public Health, and Public Health will help get them set up with an appointment at Glens Falls Hospital for the blood draw, and the results go to the pediatrician as well as Warren County, so we can follow up if there is any concerns with the level of lead found in the child. So a lot of people want to know, how do I know if my home or daycare has lead paint in it? Well, the only way to really know is to have your home or daycare tested for lead paint. The test can be done in several ways. You can have a qualified professional come in and do a paint inspection, but this doesn't assess risk. It just looks at whether or not lead paint exists in your home. Next is the risk assessment, which then looks at the condition of the paint and the surfaces where lead is being found, and do they lead to any serious concerns about sources of lead exposure. It also kind of gives you an idea of what actions can be taken to reduce the risk of lead exposure for those children. And the testing is done using a variety of methods, and you can kind of see the list here with visuals, lab tests, surface dust tests, and things like that. But these can be kind of expensive and hard to do. But here's the reason that it's really important to check your home, is because we know that the older a home is, the more likely it is to contain at least some sources of lead paint. And in Warren County, we can see that almost 30% of our homes were built before 1950, and 32% of our homes were built between 1950 and 1979, which is then at the end of when lead paint was being used that year of 1979. So we know that we have about 60+% of our homes that would fall into a time where lead paint was being used within the homes. So I do get asked from time to time, are lead kits that are used at home, do they work, and how well are they? So there have been 3 that meet the lead renovation, repair, and painting rule when used by a certified renovator. They're listed below: the 3M lead check, the D-lead, and then the state of Massachusetts has developed their own. So, but these have to be done by somebody who knows what they're doing. They can be a little bit complicated, and if they're not done correctly, can give you some false results. So again, if you're going to use those, I would say you need to look to a contractor, somebody who has some, time using these tests and has a good idea of how they work. Now you can also find kits that are sold directly to consumers, but these don't generally meet the lead renovation, repair, and painting rule requirements, but they are a good starting point. They will provide ideas and they will certainly show if there is lead in the home, if it's at a high enough level. So this is certainly another option as well if you're interested. So what we need to know is that when we are looking at our homes and we want to keep them, well maintained, is that repairs and renovations can be a big source of lead exposure. So if you are going to do any renovating and you're hiring a contractor, that contractor should be certified by the EPA for lead removal and abatement. That's really important. Child care facilities, including schools and kindergartens, and anybody else who deals with children under the age of 6, the renovators have to provide a copy of the Renovate Right pamphlet to those facilities and to the general population that is using those facilities. So any families that have children that are attending those daycares or other school facilities, they need to be notified that there is renovations going on and that it's being done in a safe and reliable way. Now, if you have a do-it-yourself project, these are not covered by EPA regulations for the family home, but you are still going to want to be careful and you want to make sure you are following up and making sure any lead containment steps that need to be taken are taken. Again, daycare facility operators should check with their licensee agency for guidance on renovations if they're running a daycare outside within their own home, but are making changes to that home. The New York State District Office at 518-793-3893 can provide guidance on lead containment. And you can also visit the EPA website that's listed below. Again, these will all have great resources for you if you're looking to do any home renovations with a do-it-yourself project. So the nice thing about lead poisoning, if there's anything nice to be said about it, is that it can be prevented. There are a few steps that people can take around their homes to make sure they keep their kids safe. First is know the risk factors that increase a child's risk for lead exposure. Things like living or spending a lot of time in a home or setting built before 1978. If you live near busy roads or any industries. If you live with people who work with lead, again, like auto mechanics or somebody who has hobbies that involve working with lead. Somebody who's come in from outside the country who may not have the same standards as the U.S. for lead. Any child who has been, found to eat paint chips, plaster, or soil, just because, again, of their age, they often put things in their mouth. Or if somebody has a sibling, a brother or sister with high lead levels, those can all be things that can kind of lead you to believe you might have a problem. So the best way to know is to have your child tested for lead poisoning at 1 and 2. Some of the things you can do for lead poisoning prevention is if you live or work in a place built before 1978, wash your child's hands often, and wash the toys as well if they're picking up dust. Dust-contaminated surfaces that could have lead on them. Mop floors and use a damp cloth to dust to keep the dust down so the particles don't get into the air. And get rid of dirty water by dumping it down the toilet. And then wash your dust cloths regularly because what they can do is build up over time and then spread lead instead of getting rid of it. And then have your house inspected for lead if you can afford it. If not, again, you can look to one of those consumer lead tests that you could use. Again, for older homes, keep those older homes and workplaces in good repair. So if you see peeling or chipped paint, use safe repair methods to keep the lead from spreading. Keep children and pregnant women away from any areas that are under renovation or repair, and make sure toddlers don't eat or play with paint chips, plaster, and again, the dust or dirt that they could pick up on their hands. Make sure you're doing a lot of good hand washing. Also, you can try to keep lead out of your home and out of your workplace. So if you participate in hobbies, again, things like pottery or fishing line sinkers, things like that, you could get lead on your clothing. So make sure you wash your hands and clothing frequently. Wash work clothes that may have lead on them separately from other clothing just to ensure there isn't cross-contamination. Keep an eye out for children's jewelry. A lot of the metal jewelry that comes from overseas is often made cheaply, and it is not monitored the same way or regulated the same way as jewelry and things in the U.S. So they can contain high amounts of lead and other poisonous metals. And don't let children put jewelry or charms in their mouths. Outside around the home, cover any bare soil with grass or wood chips just to keep the dust from kicking up. And again, keeping kids away from the base of a home where lead paint could have chipped and fallen into the soil is a good idea. And remember that lead paint and varnish can be in old toys, high chairs, and furnitures. Current regulations ban the use of any of those toxic paints or finishes on anything that a child is likely to use or is within reach of a child in childcare settings. But again, we don't want you purchasing used older cribs, dishes, painted toys, etc., because they're not likely to meet the current health and safety requirements, and there is a good chance if they were old enough, they could have lead in them. Another thing you can do is you can try to keep lead out of your food. So while cooking, it's important to know what kind of plumbing is in the home or in the daycare. Again, places with older plumbing, you should let the water run for 1 to 2 minutes and use only cold tap water for drinking and cooking and preparing infant formula. It reduces the chance of lead leaching into the water supply. Using lead-free dishes. So again, that is just trying to find dishes that have either a lead-free stamp or are made in the U.S. We often find that dishes made from Latin America, the Middle East, India, and even Asia can have high lead concentrations in their glazes or just their makeup. And so we want to make sure that we're using lead-free dishes. And we also recommend not using imported products like traditional medicines, herbs, and spices, or even cosmetics, because they are not well regulated and lead can often be found in these products. And so we just want to reduce any chances of lead coming in from outside the home. The other thing is a healthy diet can actually help a child to reduce the amount of lead they are ingesting and then absorbing. And what we find out is that calcium, iron, and vitamin C are nutrients that limit the absorption of lead in the body. And so below is a couple of lists of different foods that you can incorporate into the diet to try to help your child reduce the absorption of lead if it's in the home and you're unaware of it, or you haven't had a chance to have your home tested for lead. Increasing these types of foods can help reduce any absorption of what lead might be in the environment your child's exposed to. So what's your role? Well, as a parent, it's a good idea to have your home inspected for potential sources of lead, especially if it's a home built before 1978. You can check with your child care provider about their lead poisoning prevention efforts. So if your child is in daycare, asking about the age of the house, what they've done to ensure that paint is in good repair, that the soil out back or in a play area is being well covered and maintained, and any cleaning steps they take to reduce the chances of lead exposure. You can make sure that you reduce the risk of lead exposure when you're renovating your home by taking home renovation steps that reduce risk, and have your child tested for lead poisoning at ages 1 and 2. Specific to daycare providers, public health law covers all child care providers licensed and registered by the Office of Children and Family Services, as well as nursery and preschool providers. And your role basically is within 3 months of enrollment of a child in your program, between the ages of 1 and 6, providers should try to obtain proof that a lead test from a parent or guardian has been conducted. Proof of a test is anything signed by a medical provider stating the date of the test. Also, if you have a child without proof of a lead test, you can provide a referral to that parent to either the local health department here at Warren County or to their own child's medical provider. And you can also provide that parent with educational materials about lead poisoning prevention. So if you're looking for that information, you can contact the health department and we can help provide that for you so that you can offer it to the parents of the children in your care. So in summary, I'd like to just kind of go over some of the main points. It's important to remember lead poisoning is completely preventable. Getting your child tested for lead at age 1 and 2 is what you need to do to be sure that your child's not being exposed to lead. If you live in an older home, live near very busy roadways, you can reduce possible sources of lead exposure by covering bare soil, wet mop and wet dust regularly, repair old and chipping paint, teaching good hand washing practices, serving foods rich in iron, calcium, and vitamin C will help to slow the absorption of lead, and talk with your child care provider about reducing potential exposures to lead. And if you have any questions or concerns with the lead poisoning prevention efforts that you're in or getting your child tested, you can call Warren County Public Health for testing guidance, education, and materials. And for daycare providers, we can help get you the materials you need to help inform parents about lead poisoning prevention. Here are just a few websites I wanted to provide quickly. The New York State Department of Health has a really nice lead poisoning prevention website with a lot of resources that can be ordered online. So if you're looking to get educational materials for your daycare or even for your own personal use, you can find those there with an order form. The EPA has a lot of information on lead, including safety precautions you can take during home renovations, and ways to ensure contractors are doing the same thing, and I would highly recommend visiting their page. Upstate Poison Center, again, that is something that has a lot of information that is related to lead poisoning prevention, similar to what you'll find on the EPA and New York State Department of Health, but it also has information for acute lead poisoning, as say if a child was to swallow a pendant or even a fishing sinker or something like that, where high amounts of lead could end up in their body. They have information there. And then the CDC, Centers for Disease Control, has a lot of information as well. So these are really 4 good resources for more information about lead poisoning prevention. And finally, if you want to know locally what Warren County Public Health and the lead poisoning prevention program can do for you, if you need help obtaining a test, you can contact Sarah Arnold, our public health nurse. The phone number and email is there. And for educational materials, you can contact myself. My name is Dan Durkee. I am the Public Health Program Manager. Again, my number and my email are both available, and we will respond to you as soon as we can. I hope you've enjoyed this program. I hope you found it helpful. If you have any questions or concern, again, please call Warren County Public Health for more information. Thank you.